Hello, my name is TessaO'Dea. Thank you for the opportunity to present this proposal today. Today, I am seeking management support to develop and implement an integrated digital performance dashboard for the physiotherapy department at Austin Health. Austin Health is a public healthcare organisation, and public healthcare services are operating in an increasingly challenging environment. We have increasing patient demand due to more complex presentations, due to aging and increasing chronic disease. We have workforce shortages that are continuing on post-COVID and funding constraints that remain in place. Physiotherapy service in public health is essential to generate flow through hospital from ED all the way out into the community. And delays in physiotherapy care can significantly increase length of stay, hospital capacity, and patient outcomes. Therefore, a responsive physiotherapy service is essential, and we need operational improvements to deliver this. The physiotherapy department currently collects large amounts of really useful information to determine responsiveness of service. However, the information is held across multiple systems and reviewed through separate teams, largely retrospectively. And the fragmentation really limits managers' ability to see the full picture of departmental performance. There's a real lack in that end-to-end visibility of performance. And so emerging problems may not become visible until workforce pressures or service delays have already developed. And as a result, operational decision-making is often reactive rather than proactive. And so my proposed solution is to address this via an integrated digital performance dashboard. The dashboard would bring together the department's key performance measures in one accessible location, and the improved integration and visibility would allow managers and team leaders to monitor demand, identify pressures earlier, monitor workforce capacity and staff and resource allocation, and track activity, patient flow, service quality, financial performance in this a much more timely and coordinated way. So the purpose is not simply to introduce another piece of technology. There's a broader aim than that, which is around creating a more transparent and responsive operating model that will lead to proactive decision-making from leaders. And the evidence from healthcare literature really indicates that dashboards can be used to achieve this. Effectiveness will depend on a number of things, including accurate data, meaningful clinical measures or general measures, user-friendly design, and successful integration with existing hospital systems. And to that point, there are some risks that need to be managed, including potentially quite poor interoperability of existing systems, data quality issues, privacy and cybersecurity requirements, for patients, and limited implementation resources given the constrained public health financial situation. To overcome much of this, we need clear governance and early stakeholder engagement. Clinicians, team leaders, business intelligence, finance, and workforce leads should all be involved from the beginning in a co-design approach. The involvement will help ensure the dashboard is clinically meaningful, technically feasible, and sustainable for day-to-day operations. I recommend that the project begin by mapping the department's current measures and data sources, which should identify duplication and reporting gaps. And then we can develop a performance framework that's aligned with the department and organizational strategic priorities to help us design the dashboard. Measures chosen would be carefully selected so that the dashboard is focusing its attention on information that supports decision-making rather than just displaying data simply because it's available. And we would pilot with a small group of users and use staff feedback and performance data to iteratively refine the dashboard before a more wider implementation approach. In summary, an integrated digital performance dashboard provides a practical opportunity to improve the service responsiveness and operational performance of the physiotherapy service at Austin Health. It will connect information that is currently fragmented, provide earlier warnings of operational pressures, and enable more timely workforce and resource decisions. This will provide the foundation for moving the physiotherapy department from retrospective reporting towards proactive, data-informed operational management and ultimately support safer, more efficient, and high-value patient care. Thank you for considering this.